My name's Sophie Hasty and I'm the Parent Education Midwife at Warwick Hospital, also known as Swift. In this video, we're going to have a look at caring for your baby, so practical things like changing a nappy and bathing a baby, and how to look after yourself after you've had a baby. The policies and guidelines around COVID-19 are changing all the time. Please join the Maternity Update Swift page on Facebook for the latest information on this. The subjects I'm going to look at in this video are cleaning your baby's eyes, changing a nappy, bathing your baby, making sure your baby is safe when they're asleep, and mum's recovery from birth. It is quite common for babies to get slightly sticky eyes. This usually looks like weepiness from the corner of the eyes, and it can be white or yellow. If it goes green, make sure you speak to your midwife. Also, if the skin around your baby's eyes looks red or inflamed. Use cotton wool and cooled boiled water and do a single wipe from the inner corner of your baby's eye to the outer corner of your baby's eye, and then throw that piece of cotton wool away and use a clean one for the next wipe.
Hello, my name's Fiona. I'm a support worker at Warwick Hospital. We are just going to talk a little bit today about eye care for baby. So I'm going to show you how to wipe baby's eye. So it's very normal and that babies can get sticky eyes or sleepy dust in their eyes. So the best way to wipe it away is get some cool boiled water, pop some cotton wool in it, and then you just get baby's eye and you wipe from the inside to the outside. So you go just like that, and then you get another clean piece to wipe again like that, and then you can get some dry cotton wool just to wipe their eye afterwards.
There are two main types of nappy available, disposable and washable. Disposable nappies are very good at absorbing fluid, and it can be hard to tell if they are wet or not, as they draw the fluid away from your baby's skin. Now most brands have a wetness indicator on them, which changes colour when your baby has had a wee. Often this is a yellow line down the middle of the nappy, which goes blue when it's wet. You can see it in the top picture here. It is useful in the first few days when feeding is getting going and amounts of urine are very small, as knowing how often your baby is weeing gives us a good idea of how well they are feeding. Disposable nappies are convenient, but they are very expensive, and most brands will take about 500 years to decompose in a landfill site, so they have quite an environmental impact. Washable nappies come in many different colours and designs. They can be very cool. They are usually shaped like disposables and have popper or velcro fastenings, so they are easy to put on and take off. You can get liners to go inside them, which can be flushed down the toilet, so you can get rid of poo easily. They are quite expensive to buy in the beginning, but they will save you money in the long term, and they don't go into the waste system, so have a lower environmental impact. Many people use a combination of disposables and washables, depending on what they are doing on any given day, and they keep their washables for the next baby or pass them on to someone else, so they last for years. The contents of your baby's nappy can give you a really good idea of how well your baby is feeding. Baby wee and poo is very different from adult wee and poo, so with your first baby it's worth having an idea of what to expect. On day 1 and 2 you should expect about 2 wees a day and at least 1 poo, and the poo will be black. The black poo is called meconium. On day 3 and 4 there should be at least 3 wees a day and 2 poos, and the poo should be beginning to change. It will go sort of through black, green and end up yellow. As the poo goes yellow, that tells you that there is milk all the way through your baby's gut, and therefore your baby is feeding really well. On day 5 or 6 you should have at least 5 wees and 2 poos. The poos should be around the size of a £2 coin. Day 7 onwards, about 6 wees should continue, 2 poos, and the poo should remain yellow. Breastfed baby's poo will be quite yellow and sloppy with sort of seeds inside. They look a bit like mustard seeds. So breastfed baby poo looks a bit like a korma curry. Bottle-fed baby's poo is a bit more solid and a little bit browner. You may see some rusty red spots in your baby's nappy along with urine. These are salts that are flushed out of the kidneys and they're normal in the first few days. But after the first couple of days, they can be a sign that your baby is dehydrated. So if you see them after about 3 days, have a chat with your midwife just to discuss how things are going. Baby girls sometimes have a bit of vaginal mucus, which you may see in her nappy or around her vulva. This is often clear and stringy, a bit like egg white, but it may have some blood in it. This is completely normal and is a result of your hormones which she was exposed to before she was born. It will go away in a week or 2. Your pregnancy hormones can also lead to babies getting swollen breasts. This can affect boys and girls. Again, it's normal and the swelling will go away after a few weeks, so don't worry about it.
I'm going to be showing you how to change baby's nappy. I'm really lucky as I've got a doll with me today who is lying beautifully and still. Your baby will be a little bit more wrigglier than this doll, but hopefully you'll get the idea of the best way to change baby's nappy. So before you change baby's nappy, it's always a really good idea to get everything prepared so you're not reaching for things or leaving baby unattended while you get bits. So I've got my lovely clean nappy here ready, and I'm going to use cotton wool with some warm water. It's always best to use cotton wool especially a newborn, as wipes can make baby a little bit sore and it's not very nice for baby then. And also, just to point out with nappies, we're really lucky now because most nappies have the line down the front of it, so we know when baby's got a wet nappy, so the line goes blue, which is great. You don't have to keep checking baby's nappy to see if they're wet or dry, which is a real big help. So I'm going to start by undressing baby, only halfway. Don't want baby to get chilly, so I'm just going to undo just the poppers at the bottom. Oh. Again, I'm really lucky as baby is lying beautifully and still. Okay, so I'm going to undo the nappy, and before I completely undo the nappy, because especially if it's a little boy, they are known for weeing everywhere, so it is best just to keep that there while I get the new one ready to pop on, making sure the tabs always go on the back of the nappy. Alright, I've got my wipes, my cotton wool ready. So undo, and you always wipe from the top to the back, so we start at the top and work our way underneath. And it's also a really good idea just to lift baby's legs so we can get everything and clean. So, and also checking in the creases of the legs as well. So let's pop that there and get the clean nappy. The colour of baby's poos do change. They start off at a very black tarry colour. Then they go to sort of a greeny colour and then to a mustardy yellow, which is all completely normal. And then I'm just doing the tabs back up. And then as your baby will have the cord clamp around its belly button, it's best just to tuck the nappy underneath, just so you don't catch the belly button. So, and then I'm just going to get baby dressed again. And it's always a lovely opportunity when changing baby's nappy to chat to the baby, sing to baby. It's a really lovely bonding time for you and baby. And then we pee. 'Cause
Bathing your baby for the first time is a huge event and it's really exciting. There's a few things you can do to make sure that it's a good experience for both you and your baby. Make sure your baby doesn't get cold. If your baby gets cold, they won't enjoy their bath. And wet skin gets cold very quickly due to evaporation. So first of all, make sure the room's warm and warm it up before you bath your baby. The water temperature is also really important. It should be warm enough, but not too hot, because baby's skin burns quite easily. But not too cool, because if they get cold, they won't enjoy themselves. You can judge the water temperature by dipping your elbow into the water, and it should feel warm to touch, but not hot and not cool. You may be more comfortable using a bath thermometer, and that will give you a range of safe temperature. Go for the upper end of this range, not the lower end, and then your baby's much more likely to enjoy it. People often ask how often should they bath their babies, and that's a very personal choice. Your baby isn't really getting dirty, so you can clean them well enough by topping and tailing them. But if you enjoy bathing your baby and your baby enjoys it, do it as often as you like.
Have a go at bathing baby today. It's just like when we change baby's nappy. It's really important to have all the bits that we're going to use to hand before we strip baby off, just so we're not reaching for bits and while baby's on the changing mat. So I've got my clean nappy ready, a towel and the cotton wool ready to do baby's face with. It's also incredibly important that you get the temperature of the room correct. You want it as warm as possible. Just so when you strip baby off, they're not going to have a shock being in a cold room. And also it's incredibly important to get the temperature of the water right. It needs to be around 37 degrees. If you have a bath thermometer, then that is fabulous, that will help. Otherwise, your elbow is a very good. If you dip your elbow in the water, you'll soon be able to know if it's too hot or too cold for baby. So we're going to first of all, before we bath baby, we're going to do what we call top and tailing baby. So we're going to wash baby's face and then change baby's nappy. And that's all we do for top and tailing. And then we'll bath baby afterwards. So I'm just going to strip baby off, but leaving its nappy on. Oh, sorry, these poppers are a bit tricky. Okay, so here we are. And I'll leave the nappy on. And clean towel, and I'm just going to fold it over at the top. Okay, and I'm going to just pick baby up when I pop the towel down. Sorry, and you're not going to have a microphone lead that's going to get in your way like mine is, so you'll be very lucky when you're at home. So I'm going to wrap baby up, folding, sort of swaddling baby, nice and tight. And then just going to pick baby up, making sure that the towel is just at the bottom of its neck. And I'm going to bring him over to the bath. Oh, again, microphone lead is in the way. And I'm going to tuck baby under my arm and just hold baby. Getting positioning right is different for everyone. What I'm doing might not be comfortable for you. So work out which way or how you want to hold baby before you start bathing. Although I'm right-handed, I do a lot with my left, so I'm a bit cat-handed. So I'm just going to lower baby down using my hand and just sort of lap the water up and just wash baby's hair, just like that. And then I'm going to get the cotton wool that I very cleverly thought I was prepared for, and just use a clean piece of cotton wool to wipe baby's eye, do the face, and then get another clean bit of cotton wool to do the other eye and the other side of the face. Okay, and then I bring baby up, and then I just pull the towel up over the head so it's a bit easier to dry baby. Baby, and then I would unwrap baby and change baby's nappy how I showed you to do it earlier. And then if we're going to fully bath baby, we take baby's nappy off And if it's dirty, we clean the nappy just as we would as we were going to put a clean nappy back on. So baby's all fine. So you want to hold baby. You're going to use one hand holding baby's arm, and then your other hand is going to sort of scoop under baby and hold its legs as we go into the bath. And then I'm not going to let go of baby at all. I'm going to hold the baby with my hand and then use this free hand to wash baby with, sort of lapping the water up and washing baby. You will soon be aware of if baby is enjoying this or not. If baby isn't enjoying it, we're a little bit quicker and get baby out, as we don't want to stress baby or ourselves. If baby's enjoying it, why not leave a little bit longer? And again, we can have some nice bonding time by singing and playing as you're lapping the water up. We do recommend that perhaps you shouldn't use bubble bath or shampoo on the baby when they're newborn. But if, for instance, when baby is born, if they've got a bit of mess in their hair, then if I were you, I would put a little bit of shampoo in their hair just to rinse off any nastiness that's in the hair. Okay, so baby's nice and clean, so I'm going to put my arm under baby's feet and bring baby to the clean towel and wrap baby up just while I dry them so they don't get cold, sort of rubbing and then putting a clean nappy on them. Making sure the tabs are at the back, just like we spoke about before when changing nappies. And then tucking under, and then I'd pop a hat on just so baby doesn't get cold, keeping in that body temperature while you dry the rest of baby off.
When your baby is born, the cord that links your baby to your placenta is clamped and cut. The clamp is a small plastic clamp, and this stays in place until the cord falls off, and that takes anything between 1 and 3 weeks. To start with, the cord is creamy in colour and quite thick and fleshy. Over the first few days, it turns black and shrivels up. It can be quite smelly, and the smell is usually normal, and so long as the skin around your baby's cord stays healthy looking and doesn't become red or inflamed, it's nothing to worry about. But if you're not sure, ask one of the midwives to have a look. The best thing to do with your baby's cord is nothing, just leave it alone. Don't wash it or put any talc or creams on it, just leave it alone. Coming up is a video about keeping your baby safe while they're asleep. I know this is a scary subject, but actually it's really important that we talk about it because there's information that's available to you that really makes a difference and keeps your baby safe. For more information, have a look at the Lullaby Trust website.
Hello, my name's Sophie. I'm the Parent Education Midwife here at Warwick. And I'm going to talk to you about safe sleeping for your baby. So there's a few very firm recommendations about how you make sure that your baby is safe when you put them down in a cot to sleep. One of the most crucial ones is that your baby always sleeps on their back, like this baby is in the cot here next to me. So on their back with their feet to the bottom of the cot, and the blankets over the top of the baby and tucked in down the sides of the mattress like in an old-fashioned bed. It's really important that your baby doesn't get too hot when they're asleep. So your baby never needs a hat in the house, and certainly not when they're asleep. So your aim would be that your baby sleeps in a room with a temperature of about 18 to 20 degrees, and they need enough blankets or clothes to keep them warm. To judge that, pop your fingers down inside their vest and feel how their body feels. Your baby should feel warm to touch, but not hot. They should feel like your body feels when you're a comfortable temperature. If you think they feel too cool, put some more layers on. If you think they feel too hot, take some layers off. So the room temperature should be between 18 and 20 degrees, which is not actually very warm. And a lot of new parents get very confused because the postnatal ward, Swan ward, and the special care baby unit and the Bluebell Birth Centre are all very warm. And the midwives are very keen to make sure that your baby doesn't get cold in the first day or so after they're born. In that first 24 hours, babies don't maintain their temperature very well, and if they get cold, then they get quite unwell. So in that first 24 hours, it is really important they're in a warm environment. But as they get a little older, and by a little older I mean 24 hours or so, actually they're safer to be a bit cooler than too hot. So it's important that you maintain that 18 to 20 degrees. There's a few other things to think about keeping your baby safe, and that is that you don't smoke around them. And if you have any alcohol to drink, you're very careful about sleeping with them in your arms. That's particularly important around falling asleep on a sofa with your baby. This is an incredibly dangerous thing to do. So if maybe you come downstairs at night because your baby is restless and your partner wants to get some sleep, you sit on the sofa, have a cuddle and drop off. This is really, really dangerous. If you think you're feeling sleepy, put your baby down in a cot beside you and then you can fall asleep safely. Co-sleeping, so that's having your baby in bed with you, is something that we don't recommend, and certainly we never recommend for anybody that smokes or has had any alcohol to drink or taken any medication that might make you sleepy. I hope that's helpful and not too confusing. The basic message is that your baby shouldn't get too hot, should lie on their back to go to sleep with their feet to the bottom of the cot and never needs a hat in the house. Thank you.
Now I'm going to talk about some issues that will affect mums after they give birth. You will have some vaginal bleeding after your baby's born, and it can be really quite heavy and last on and off for up to 6 weeks. In the first 24 hours it will probably be bright red and you may get a few small clots. If you notice any clots that are bigger than about a 20p piece, please speak to one of the midwives and they may want to see your clot, so save it on a pad. After 24 to 48 hours the bleeding should become darker and over a period of a few days will go brown and then pink and watery, but it can fluctuate between red and brown and fluctuate in heaviness as well. If you're not sure about your bleeding and you think it's too heavy, please speak to one of the midwives. You will need a lot of maternity pads, and these will need to be quite big pads like the ones in the picture. You can use straightforward pads like these, but some women choose to use incontinence pads because they're particularly absorbent, and some pads come in the shape of pants and they're really easy to use. You mustn't use tampons because they can introduce infection into the vagina and the uterus. Make sure you're using big, comfortable pants, preferably cotton because they're not so sweaty, and big pants because they won't rub against your stitches and they hold your pad in place better. After a vaginal birth, it is very common to have some stitches in your perineum. Keep these clean by washing yourself with water after you go to the toilet. Change your pads regularly. With caesarean section stitches, you will have a dressing over these which will be taken off maybe when your baby is a week old with one type of dressing. A simpler dressing will come off after 24 or 48 hours. Just wash your wound as normal, but don't put any soap on it. If the pain gets worse in your stitches, speak to one of the midwives because we would want to check that you weren't getting an infection. Take regular pain relief. It's really important that you're comfortable because it's important that you can move around. Take paracetamol every 6 hours. Take 2 tablets every 6 hours. You can take ibuprofen at the same time. You take that every 8 hours, and you would take 400 milligrams every 8 hours. Some ibuprofen tablets are 400 milligrams and some tablets are 200 milligrams, so check what you've got. It's worth getting some to have at home before you have your baby, so you've got a good supply. If you have a caesarean section, you will probably be given some liquid morphine to take alongside the ibuprofen and paracetamol, and that's a top-up pain relief, so you take it when you need it, but take the ibuprofen and paracetamol regularly because they will keep a lid on your pain, which makes it more manageable, and then you can move around. Try to start pelvic floor exercises as soon as possible after you give birth to your baby. This might be quite difficult at first if your perineum is sore, but try and do it anyway just to set the intention of doing it, even if you can't feel what you're doing. To do your pelvic floor exercises, squeeze between your legs as though you're trying to stop yourself going to the toilet, but don't do it while you're going to the toilet. So squeeze and hold for the count of 10 if you can, and then relax for the count of 10. Try and do this 10 times, 3 times a day. This will help your pelvic floor recover from giving birth and reduce your chances of having any incontinence when you're older or even soon. As you feel ready, you can move around more. If you've had a straightforward birth, you can start gentle exercise as soon as you feel up to it. If you feel like it, go out for a walk. Your baby will be fine so long as they're warm and wrapped up and either in a pram or in a sling. You can take your baby out as soon as you feel ready. It's essential that you take some time out to look after yourself as well as looking after your baby. If you need to go to the toilet, go to the toilet. Your baby will be fine for 5 minutes while you go. Also, you need to take time for a shower, eating, drinking, and just doing all the things that you need to do to make yourself feel okay. Eating and drinking is really important. You may find your appetite isn't as good as it was, but make sure you eat anyway. Asking somebody to make food for you is really helpful. And if you sit down to feed your baby, make sure you have a glass of water next to you. You will probably get quite thirsty while you're breastfeeding, as breastfeeding takes a lot of fluid out of your body. So have a drink while you're feeding, and that should sort it out. You probably won't have your bowels open for a few days after you give birth. That's completely normal and doesn't mean that you're constipated. But make sure you eat lots of fruit and veg, and that will help make sure that your stool is nice and soft. But if you do feel as though you're becoming constipated, have a chat with one of the midwives and she may suggest some medicine to soften your stool. It may sting a little when you pee. If that happens, just pour some water from a jug over your stitches and that should help. If that feels awkward, you can pee in the shower, and I know that sounds a bit weird, but really it does work. Having a baby is a huge life change. If it's your first baby, you probably go from being fairly responsibility-free and able to do what you want when you want, to being totally responsible for a tiny baby who relies on you for absolutely everything. And that is a massive life transition, however much you love and want your baby. Often in the first few days, parents feel really euphoric. They're happy, excited, and everything's great. Around day 3, some mums get what we call the baby blues. They may be very weepy or irritable, or feel generally low, anxious, or restless. This is completely normal and usually only lasts a few days, as it is due to hormonal changes. If it goes on for more than a few days, then possibly it's going into postnatal depression. Postnatal depression doesn't necessarily start just after birth. It can start at any time within a year of having a baby. So if you feel depressed, overwhelmed, very anxious, moody, or you start cleaning obsessively, or have any mood-related problems, please speak to your midwife if you are still seeing her, or your health visitor or GP. Postnatal depression is incredibly common and it is nothing to be ashamed or embarrassed about. It's very treatable as well. Some women choose to take antidepressants and they can be helpful. Others have counselling or other talking therapy, or a combination of both. Partners can find becoming a parent challenging too. They can also suffer from postnatal depression. Watching the person that you love going through labour can be upsetting, and becoming a parent is a huge transition, whether or not you have actually given birth. If partners are having difficult feelings or emotions, please talk to someone. Your GP or health visitor is probably the best place to start with. There is lots and lots of support available for difficult postnatal feelings. The NHS website is great. Locally, there is a charity called By Your Side, which was set up by a mum who lives in Warwick who suffered from postnatal depression. They have a Facebook page called By Your Side, so just search for them on Facebook. So if you are feeling down, overwhelmed, or just finding life really hard, please talk to somebody. Reach out and help is there for you. Don't bottle it up. One of the midwives from your practice team will visit you at home the day after you leave hospital, or if you have a home birth, the day after your baby is born. After this, we will arrange further contacts with you, which will either be by phone or home visits. We will always visit you on day 5 as we need to weigh your baby and do a blood test. It's really important that we have the correct address for you on your notes, that's Badger. So if that's not correct, please can you tell one of the midwives? And if you have any specifics about when you may not be at home or times that you want to be visited, please tell the midwife who's arranging the visits or ring the Bluebell Birth Centre to update us. When your baby is 5 days old, the midwife will ask if you are happy for her to do a blood test on your baby. This blood test is looking for several conditions. They are underactive thyroid gland, sickle cell anemia, cystic fibrosis, and a cluster of metabolic conditions that are all treated with special diets. She will take the sample by taking a small drop of blood from your baby's heel and dropping it onto a card. The card is sent away to a lab and they will write to you after about 2 weeks if everything is normal. If there are any problems, you will get a phone call much more quickly, but usually that's only because the test needs to be repeated, not because your baby is unwell. Around 2 weeks after your baby is born, or when you and your midwife agree that you are ready for this, you will be discharged to the care of the health visitor. Health visitors are professionals with training in supporting new parents, feeding support, and child development, and they work with families to give preschool-aged children the best possible start in life. They will see you periodically to weigh your baby and do developmental checks. You will also need to see your GP when your baby is 6 to 8 weeks old, and the GP will do some checks on your baby to ensure they are developing okay and you have recovered from the birth. They will also talk to you about contraception. It's important that you don't have sexual intercourse until you feel like it and you have completely stopped bleeding, and this may not happen before your 6-week check. But if it does, please make sure you use some contraception because you could ovulate when your baby is 3 weeks old. You need to register your baby's birth at the registry office, and you can make an appointment to do this at www.warwickshire.gov.uk/birth registration. You will then get a birth certificate for your baby and can apply for child benefit. If you and your partner are married, only one of you needs to go to this appointment, But if you're not married and you want your partner to be on the birth certificate, then you both need to go. Thank you for watching. I hope you found this helpful. If you have any questions, please speak to your midwife or ring Swan Ward or the Bluebell Birth Centre. Thank you.